Wisdom teeth. I guess typically you would go to an oral surgeon for wisdom teeth,
yeah.
but you've had advanced training with wisdom teeth.
Absolutely. I've had advanced training with wisdom teeth. I haven't had to refer a wisdom tooth to an oral surgeon in 15 years. I love taking out wisdom teeth because I love working with young people. Most people are afraid of getting their wisdom teeth out. And I had a really, really bad experience when I was in the service getting my wisdom teeth out. I was like literally tied down to the chair. My head was tied down. It was so traumatic.
So they brace your head against.
Oh, it was.
You were telling me this in the green room. Is that right?
It was so traumatic. I was a scared 18-year-old kid, and it was so terrible at the time. And so I took from that experience. Now, as a provider, I will make sure that my patients have a good experience. So I pride myself in taking those teeth out quickly.
How many extractions do you think you've done over the years?
I calculated the other day, in 18 years, I've probably extracted close to 70,000 teeth.
Is that right?
Yeah.
That's a lot.
It's a lot. It's a lot of teeth.
Now, what about pricing? Because I know you're kind of, because you do everything right there.
Yeah.
Where do you stand on pricing as opposed to going to an oral surgeon? Are you less?
I'm way less.
About the same?
I'm way less.
Way less meaning how much less? Half
Probably
off?
50% of what you'd pay at an oral surgeon.
Okay. And they still get some sedation?
They get some sedation, and they're able to come in with less stress because you don't have to go to a different office. You don't have to bounce around town to different providers. You come see me. A lot of times I have parents that are my patients. They'll say, Dr. Miller, do you do wisdom teeth here? I'm like, absolutely, I do wisdom teeth. So patients will come see me, and they'll have their kids come in, and again, they take the medicine that makes them sleepy. They forget the whole procedure. They wake up, and they don't even realize it was done.
Now, wisdom teeth, if they're not hurting, why get them out? Help me understand that.
Yeah, that's a good question. I hear that all the time. It doesn't hurt. Okay. Well, what happens if wisdom teeth left untreated will become impacted and cause damage to the adjacent teeth in the jaw, oftentimes causing crowding in your jaw. So think of a 19-year-old, beautiful 19-year-old young lady who's had her braces on, did her braces, has a beautiful smile, and then here come the wisdom teeth, start pushing on those teeth. In 3 or 4 years,
So they get crooked.
their teeth will grow crooked again. Absolutely. Or those wisdom teeth can become infected. There can be pockets of tissue or skin around those wisdom teeth as they're starting to erupt that can cause infections in the bone, causing terrible pain.
So you're equipped to handle these kind of things?
Absolutely, absolutely.
Because parents are the ones, I guess, that have to make this decision.
Yeah, parents have to make the call. I don't have too many teenagers looking up.
Now, especially if they're in pain. I mean, if they're having discomfort,
Yeah,
they got to do it right away.
they do it right away. Absolutely.
Why? What's causing the pain?
The pain is caused by infection because those teeth are pushing in and the gums are inflamed and infected. And so if we don't address that infection, it can turn more serious. In some
Will it
cases,
spread to other teeth?
it can spread to other teeth. It can spread into the gums. It can spread into the cheek, and you could be left with a large abscess. It's definitely something you want to take care of as soon as possible.
But it's a straightforward procedure.
So
Pretty
straightforward.
easy for you to do.
It's so easy.
Why don't all dentists do
In fact,
wisdom
Randy,
teeth?
my license plate says wisdom tooth.
Your license
My
plate
license
does.
plate. That's how much I love taking out
you
wisdom
love
teeth.
it.
I love it, yeah.